The COVID crisis that is unfolding in India right now, let's look to what is happening in that country. It's witnessing a level of infection not seen anywhere in the world at any point during the pandemic. That is how grave the situation is. And here's the big number. Today, officials reporting 314,835 new coronavirus cases in the last 24 hours. That breaks the global daily record that was set only yesterday. Deaths also at a new high. Overall, India is the second worst affected country on the planet, behind the United States, with a total of almost 16 million infections and a situation that is seemingly spiraling out of control. So we want to take you to India for a look at the situation on the ground. With us this morning, Ishan Garg, who is live from New Delhi this morning, and really good to see you on this very important story, Ishan. Truly stunning numbers, more than 300,000 cases in a day, and the suggestion is that that could quickly cross 400,000 cases a day very soon. Tell us about that, what is driving this, and what impact it's having on India's healthcare system.
Well, India's healthcare system is already at a point where several experts are calling it crumbling. There are hospitals across the country reporting shortage of almost everything, all the way from hospital beds to ventilators to intensive care units to oxygen even. In the capital city of New Delhi, where I am right now, the state government has sounded the alarm 3 times in the past 3 days, claiming that some of the biggest hospitals in the city only have got oxygen good enough for 3 to 4 hours. That's how dire the situation is in some parts of the country. It's also at the same time when India's vaccine supply is also running short. There are people who've been unable to find even the first dose of the vaccine, and folks who need a second shot, that shot has been delayed. Experts are saying that getting COVID is bad as it is, but there couldn't be a worse moment to get COVID, and India could perhaps be the worst place in the world at the moment to get it in.
Ishan, not just the number of cases, I was mentioning the number of deaths. Those have also reached high numbers in terms of daily totals. This is a very grim question, but disposing of all of those bodies, what is the difficulty for authorities there in India? And of course, to try to confront this, vaccines, how available are they?
Well, that's proving to be a major challenge, and this is something that was completely unforeseen. One does not think about these things, even in terms of urban planning. In Delhi, some of the biggest crematoriums just a few days ago said that they were running out of space very quickly. Some of the incinerators that were disposing of dead bodies in the states of Gujarat in western India melted down because they were continuously burning bodies 24/7. And that gives you an accurate picture of how bad the situation is in India. And also the bodies that are going to these crematoriums, they are way above the numbers that are being reported by the government as being related to COVID deaths, which is why experts are saying that the figure of 2,000 deaths that we are seeing in India, the real numbers could be 10 times more than that. So it could be possible that close to 20,000 people are dying every single day. And that's why vaccination becomes important. The government has approved a grant of more than $500 million to bulk up the local domestic manufacturers, so folks who are producing the Oxford AstraZeneca vaccine or the locally made Covaxin. And on top of this, India is also fast-tracking approval to import the vaccines made by Pfizer, Moderna and Johnson & Johnson. And the hope is that when these vaccines hit the shelf, India will finally be able to get the pandemic under control.
Ishan Garg, thank you for all of this.